You know, our NHS is at crisis point. A hospital's been forced to close its A&E department at night. The boss of another hospital stepped down over staffing shortages, and a children's A&E department has shut down. Just 3 things to have happened in the last couple of months. But could there be more to come? Today, health campaigners warned of draft proposals that could see cuts to NHS services across England.
These are radical changes to frontline NHS services. They're changes that will affect our doctor surgeries, our hospital beds, our A&E departments, and they show the reality of an NHS that's in the midst of a funding crisis.
The plans could include the closure of the A&E department at Midland Metropolitan Hospital. In Leicestershire, the number of acute hospitals reduced from 3 to 2. And in Leeds, proposals that could see the loss of 5 hospital wards. The NHS needs to make savings of £22 billion, but there are fears the plans won't save much money.
There is a lot of optimism that these plans may look to invest in community services, invest in mental health and general practice. It will be a disappointment if they've turned out to be shuffling services between big acute hospitals.
And there is anger, with one council refusing to sign the draft proposal because of their concerns it would lead to this West London hospital closing.
If you look at these plans, you can't help feeling that when people say that the government is hell-bent on the piecemeal dismantling of the NHS, these plans prove it.
The government, though, denies those claims, with NHS England saying it's hardly a secret efficiencies in the NHS need to be made. They stress that plans are still at a draft stage and no measures will be approved without rigorous scrutiny. But there are concerns about what sort of future the NHS is facing. Charlotte Grant, 5 News.